Hello, I'm Ji Young-ho, an internal medicine doctor who has been meeting with elderly patients in the clinic for over 50 years. This year, I turned 87, yet I still see patients at least once a day. Through decades of caring for tens of thousands of people, I've come to one clear realization: health doesn't come from something grand, but from the smallest of habits. Especially as we grow older, even a single small daily action can be the difference between life and death. Just last month, something heartbreaking happened. 3 elderly gentlemen from my neighborhood, whom I used to see every morning at the park, were suddenly rushed to the hospital. All 3 had made the same mistake: one wrong action after a meal, and one of them never woke up again. As a doctor, it pained me deeply to witness how something so seemingly insignificant in our daily lives could be so fatal. What made it even more tragic was knowing that this entire situation could have been prevented if only they had known a simple piece of information. What I'm going to share with you today is knowledge that could completely change the next 10 or 20 years of your life. To receive the full benefit, please watch this video until the very end. And I ask you, from the bottom of my heart, to share this information with other older adults around you. One person's attention could save several lives. This message is especially important for seniors who live alone, because in an emergency, they may not be able to get help right away. That night, I couldn't sleep. The thought haunted me: if only I had warned them earlier. I realized then that all the experience I'd gained fighting alongside my patients in the clinic over 50 years couldn't stay confined within those walls. So today, I'm speaking to you. If you just follow this one simple rule, manage the 30 minutes after a meal, you can keep walking in the park instead of lying in a hospital bed. The actions you take in this short period can determine your health, even your survival. Let me explain in detail. One of my patients was a 79-year-old woman named Kim Sunja. She had been healthy her whole life, but after every meal, she had a habit of lying down on the sofa to watch TV. "It's just so comfortable to rest after eating," she would say. Like many older people, she believed that relaxing after meals was perfectly natural, and in her younger years, it hadn't caused her much trouble. But our bodies change subtly as we age, especially the digestive system and cardiovascular functions. Then one day, she was rushed to the ER with sudden chest pain and dizziness. Her face was pale and she was sweating profusely. At first, we suspected a heart attack, but after careful examination, we discovered it was severe acid reflux. Her stomach acid had flowed backward into her esophagus, irritating the nerves near her heart and mimicking heart attack symptoms. Thankfully, she was discharged without major complications, but the same symptoms kept recurring. Even with medication, she continued to suffer from heartburn and chest pain. She would often ask me, "Doctor, I eat so healthily. I've cut back on salt, and I eat lots of fruits and vegetables. Why am I still in pain?" That's when I asked her about what she does after eating, and then explained. What you do after eating can sometimes be more important than what you eat. Most health advice these days focuses only on food and nutrients, but little is said about the importance of post-meal behavior. After a meal, our body enters a very special state. Roughly 25% of our blood flow is diverted to the digestive organs to aid digestion. That means less blood goes to the brain and heart during that time. These are organs that require a constant, stable supply of blood. That's why these 30 minutes are so critical. If we act carelessly during this time, it can further reduce the blood flow to these vital organs and trigger dangerous consequences. Since then, I've made it a point to tell all my patients the same thing. The 30 minutes after a meal are more powerful than any medicine. I can't tell you how many people have been able to cut back on their medications and restore their health just by changing their post-meal habits. Everything I'm about to share comes from what I've learned over 50 years of reading medical literature and treating thousands of patients. This isn't knowledge typically covered in medical school. Medical students are taught disease mechanisms and pharmaceutical treatments, but how small everyday habits impact our bodies. That's something only real-life clinical experience reveals. This concerns your health and your life, so please stay focused until the end. And if you find this information helpful, please share it by clicking like or subscribe, so that more seniors can hear it and protect themselves. Now, let's talk about the 3 things you must never do after a meal. Avoiding just these 3 actions can dramatically improve your health. First, washing dishes or cleaning right after eating. I believe this is one of the most common mistakes, especially among women. Those who have spent their lives taking care of their families often head straight to the kitchen after meals. You may have heard things like, "It feels cleaner to wash up right away," or "You have to move after eating so you don't gain weight." But after a meal, the exact opposite is true. Post-meal, your body needs to focus on digestion. Digestive juices are being secreted, and a large amount of blood is drawn to the stomach to support this process. If you suddenly begin physical activities like washing dishes or cleaning, what happens? The blood meant for your stomach is redirected to your arms and legs. Digestion slows, your stomach becomes strained, and your heart and brain may not get sufficient blood, creating an unstable state. This can lead to indigestion, heart palpitations, and even dizziness. Let me share the story of Kim Young-hee, an 80-year-old woman from Cheongju. She spent her whole life cleaning the kitchen immediately after eating. "I just don't feel right unless I clean up right away," she'd say. One day, after lunch, she was wiping down the sink when she suddenly felt dizzy and collapsed. She seriously injured her knee in the fall and couldn't walk properly for over a year. The orthopedic surgeon told her that if she hadn't fallen, she could have walked another 10 years without issue. That comment broke my heart. And she's not alone. There are countless cases like this. Someone lifting heavy laundry right after eating and worsening a spinal disc injury. Another slipping while scrubbing the bathroom and hitting their head, all because they didn't rest for just 30 minutes after a meal. Dishes will still be there after 30 minutes, but a damaged knee or back may never fully recover. So treat those 30 minutes after eating as rest time. Don't move, just sit down and relax. Second, lying down or reclining after eating. Many people lie on the sofa to watch TV after a meal. It's comfortable, I understand. After a satisfying meal, lying back and watching your favorite show sounds perfect. But this habit is actually dangerous, especially as we age. Our bodies digest most efficiently when we're sitting or standing upright. The stomach is a long vertical pouch designed to use gravity to help move food downward. But when you lie down, especially on your back, it creates the perfect conditions for stomach acid to rise up into the esophagus. The muscle between the stomach and esophagus, known as the lower esophageal sphincter, weakens with age. Lying down puts even more pressure on this weakened valve. At first, it might just feel like heartburn, but over time, it can develop into chronic esophagitis or even ulcers. In severe cases, it can increase the risk of esophageal cancer. Studies show that around 70% of patients with esophagitis or esophageal cancer had a habit of lying down after eating. When stomach acid rises into the throat, it can also trigger coughing or respiratory problems like asthma. One elderly man named Lee Myung-soo, who lives in Gyeonggi province, lay down immediately after meals for over 10 years. Eventually, he developed chronic gastritis and esophagitis and had to rely on medication daily. At night, he couldn't sleep due to the burning in his chest. But after he began sitting upright for 30 minutes after meals, he no longer needed antacids. "I can't believe no one told me this before," he said. "Such a simple change, and yet it made all the difference." Lying down may feel pleasant, but it harms your body. That brief comfort can come at the cost of long-term suffering. Remember, just 30 minutes sitting upright can protect your health. What's the best posture after a meal? Sit up straight, with your back upright and your body slightly leaning forward. This position supports digestion and prevents acid reflux. Third, taking medication immediately after a meal. You've probably heard the phrase, "take your medicine after eating." But that advice is only half true. Some medications, especially those that irritate the stomach lining, are indeed safer to take after food. But there's a big difference between taking medicine right after eating and taking it 30 minutes later. This distinction becomes even more critical for important medications like those for high blood pressure, heart disease, or diabetes. As I mentioned earlier, blood flow after eating is focused on the stomach to support digestion. So what happens if you take medication at that exact time? First, the absorption rate changes. When the stomach is full of food, the medicine can mix unevenly with its contents, leading to poor or inconsistent absorption. Also, because blood circulation is concentrated in the digestive tract, the medication's effect might be delayed or altered. This is especially dangerous for drugs that directly impact your circulatory system, like antihypertensives or diabetes medications. Taking them immediately after eating can cause dizziness, nausea, and in some cases, even fainting. In fact, a hospital in Japan conducted a study and found that about 15% of falls among people over 70 were related to medication taken immediately after meals. That's not just a number. It represents real suffering. Let me share a heartbreaking story of Park Young-ho, a gentleman living in Iksan, North Jeolla province. He had always been healthy, but one day after taking his blood pressure medication immediately after eating, he fainted. The fall broke his hip and he had to undergo major surgery. After that, he was no longer able to live independently and had to move into a care facility. A single habit changed the course of his entire life. In most cases, it's best to take your medicine 30 minutes after meals or 30 minutes before, depending on the type of drug. The ideal timing depends on the specific medication, so always ask your doctor or pharmacist. This is especially important if you're taking multiple prescriptions. Each drug may have its own optimal time for maximum effectiveness. When you see instructions like, "take 30 minutes after meals," on a prescription label, remember, that's not just a casual suggestion, it's a safety guideline designed to protect your health. Now let's talk about what you should do after a meal. These healthy habits can help you live longer and feel better. Avoiding harmful behaviors is important, but cultivating positive habits is equally vital. When both come together, true health is achieved. First, drink a glass of lukewarm water 10 minutes after eating. Cold water can shock the stomach and disrupt the activity of digestive enzymes. On the other hand, a cup of lukewarm water supports digestion and soothes the digestive tract. Ideally, the water should be close to body temperature, and don't chug it. Sip slowly, in small amounts. This helps soften the food and assists digestive flow. Let me tell you about Mr. Park Cheol-soo, a man from Daejeon. He suffered from chronic heartburn for most of his life, but after he started drinking lukewarm water after meals, the heartburn disappeared completely. He had been taking antacids daily for 45 years, and now he no longer needs them. "Why didn't anyone tell me this sooner?" he asked. Such a simple habit, yet incredibly effective. This practice is especially helpful in old age, when digestion naturally slows. There's another benefit to drinking water. As we age, our sense of thirst dulls, and we can become dehydrated without realizing it. Drinking water regularly after meals helps maintain adequate hydration. Without enough fluids, blood becomes thicker, which places a greater burden on the heart and can impair brain function. In fact, studies show that even mild dehydration can reduce cognitive performance by about 15%. Second, take a gentle walk 30 minutes after eating. Walking immediately after a meal can be harmful, but walking 30 minutes later for 10 to 15 minutes is incredibly beneficial. Think of it not as exercise, but as a gentle aid to digestion. You're not trying to raise your heart rate. Walk at a comfortable, relaxed pace. This kind of light movement helps with digestion, stabilizes blood sugar, and supports cardiovascular health. Mr. Jung Young-soo from Incheon developed a habit of walking around his neighborhood for about 15 minutes after meals. As a result, he was able to cut his diabetes medication in half and lost 5 kilograms. Most surprising of all, his sleep quality improved dramatically. At first, it felt like a chore, he said, but now I can't live without it. If I don't walk after eating, I feel like something's missing. Just by walking gently, his blood sugar stabilized, his digestion improved, and he slept better. Remember, don't walk too fast. Walk slowly, without becoming short of breath. And if possible, do it outdoors. Fresh air and natural sunlight provide extra health benefits, but if the weather is too hot or cold, walking indoors is fine too. Everyone, remember this: the 30 minutes after a meal are stronger than any medicine. Just managing this time well can reduce your dependence on medication and help you stay away from hospitals. Let's recap what we've discussed so far. There are 3 things you must not do after eating. 1. Doing the dishes or cleaning right away. 2. Lying down or reclining. 3. Taking medication immediately after a meal. All 3 of these actions interfere with digestion, destabilize the blood supply to the heart and brain, and can lead to dangerous situations, especially in older adults whose natural ability to recover is diminished with age. Now, the 2 things you should do. 1. Drink a glass of lukewarm water about 10 minutes after eating. 2. Take a slow, light walk 30 minutes after eating. These habits improve digestion, enhance blood circulation, and support your overall well-being. Also remember, your posture right after a meal matters. Sitting upright with your back straight and your body slightly leaning forward is ideal. This isn't just good manners, it's a habit that can literally protect your life. This position allows your stomach and intestines to stay in their natural alignment and function optimally. So, starting today, what will you change first? Perhaps it's time to break that habit of lying down right after meals. Or maybe, instead of jumping up to clean the kitchen, you can wait just 30 minutes. As a doctor, this is the advice I most wanted to give you, because small changes can protect your greatest treasure, your health. From everything I've learned in my 50 years of medical practice, one truth stands out. Good health doesn't come from something grand or complex. It begins with small, consistent habits. For older adults especially, these lifestyle adjustments can be more effective than any pill. Medications may offer temporary relief of symptoms, but they often don't address the root cause. In fact, a study conducted at a university hospital in Seoul showed that elderly individuals over the age of 65 who consistently managed their post-meal routine for 30 minutes experienced a 47% lower incidence of digestive diseases than those who didn't. This isn't just a statistic. It's a reflection of real lives, real health, and real outcomes. If this information could help save someone's life, please share it with those you care about. Until now, most health advice has focused on what to eat. But as I've shown you today, how you behave after eating is just as important. True health comes from balancing these 2 aspects. In the next video, I'll be sharing emergency response tips for seniors living alone. What should you do if sudden chest pain or dizziness strikes after a meal? When should you call emergency services? I'll provide crucial, life-saving information for those unexpected moments. Please make sure to come back for that. And if this video has been helpful, tap the subscribe and like buttons so that more people can benefit from this essential knowledge. I sincerely wish you good health. I hope what you've learned today brings even a small but meaningful change to your daily life. Thank you.